In this video, we'll show you how to safely give an intramuscular injection in the hip using the ventrogluteal site. Start with proper hand hygiene. Wash your hands or use a sanitizer to prevent infection. Position the patient comfortably on their side or back, keeping the muscles relaxed. Now locate the correct site. Place your palm on the greater trochanter. Point your index finger toward the anterior superior iliac spine and extend your middle finger along the iliac crest. The V shape between your fingers is the safe injection area. Clean the area with an alcohol swab and allow it to dry completely. Prepare the syringe, check the medication, and remove any air bubbles. Insert the needle at a 90-degree angle straight into the muscle with a steady hand. If required, perform a gentle aspiration. If no blood appears, slowly inject the medication. Once finished, remove the needle smoothly and apply light pressure with cotton or gauze. Finally, observe the patient for any discomfort or unusual reaction. Always follow proper technique and safety guidelines when giving injections.